Hello, welcome to the Empty Stocking Fund Partner Agency Profiles. I'm Danielle Ramasiati, Executive Director of Charities Foundation. This season, we are meeting with leadership from our 20 partner agencies to hear more about how your donations have made an impact. Today, I'm joined by Lisa James from Peak Vista. Thank you for joining us.
Absolutely. Thank you for the opportunity to talk about my favorite subject, which is Peak Vista Community Health Centers.
I love that. All right. Well, to start then, tell me a little bit about your role.
I am the Senior Director of Philanthropy and Advocacy. So I do a lot of the external work for Peak Vista, not really much clinical work, but I raise funds and also raise awareness with our legislators on the federal, state, and local level.
Great, thank you. And so tell me a little bit about Empty Stocking Fund dollars. What kind of impact do they have on Peak Vista?
First of all, it is immeasurable how much good they do. I want to tell you about Emma Grace. Emma Grace is one of our pediatric patients. She had really horrible pain in her mouth, like horrible for days, screaming. So her folks brought her to our dentists. We are integrated medical, dental, and behavioral health care at Peak Vista. And our dentist couldn't even get into her mouth because it hurt so badly.
Yeah.
And she was so scared. And her family was scared because facing a $4,000 bill that you don't know how you're going to pay for, it's impossible. Yet Emma Grace couldn't eat. She couldn't go to school. You know, she couldn't learn because all she could do was feel the pain. So because of the Empty Stocking Fund, our dentist was able to find a partnering dental agency, a clinic that does sedation. Sedation alone for a pediatric patient is $1,200. And she had 5 teeth that they needed to work on. And thank you so much to all of you who support the Empty Stocking Fund, because you made sure that Emma Grace was able to go to a dentist, have sedation. They were able to work on all 5 teeth that needed work in her mouth. And now she has a big smile and she's back at school. And her parents, who were feeling like they were going into crisis, felt instead lifted by the support of this community. So thank you so much.
Thank you for sharing that powerful story. You just kind of answered part of this question, but I'm going to give you another shot because I know there's more. Every agency and every one of our Empty Stocking Fund agencies have something very unique and special about them. What do you want to share that's so unique about Peak Vista?
Well, what Peak Vista does, it's, if you think of boutique clinics, we do that, but we do it for everybody because we integrate medical care with dental care, with behavioral health care.
Sure.
And so when you come in and see your doctor and you mention something about your mouth, they'll say, hold on a minute, may I bring in, and they'll bring in a dental hygienist who can have a look, see what we need to do. Or if you come in and you're feeling down and you're not feeling safe with being depressed, we bring in a behavioral health specialist right there at that time, in that same room, in that same building. And so that ability to really give what is, I think, the model of excellent health care to anyone in the community who comes in. We serve 74,000 people a year. But that integration is what sets us apart.
It truly is unique because I know that does not happen at regular doctor's office. That's fantastic. Thank you. As we head towards the end of 2025 and the beginning of 2026, what are some things we should look for? Big things coming out of Peak Vista.
Well, it's a big thing, but I'm not sure we're going to be all smiles about it. What we have seen, actually the trend started at the beginning of May in 2023, and it's continued, is that more and more people are losing their health insurance. And we are really doubling down to make sure that people know, sorry, this is making me very emotional, that we are there for them. We are there for them if they have commercial insurance, if their employer provides insurance. We're there for them if they're on Medicaid or on Medicare. And if they have no coverage at all, we're still there for them. and to have some sense of what this means in our community. A family of 4 who don't have insurance, so 2 parents and 2 kids. It costs us $5,000 a year to provide them health care. $5,000, and that's a real number.
Yep.
For those folks who don't have insurance and don't go to the doctor, they end up using the emergency room as their primary care. But by that point, they've let things get so out of control that the average cost for a preventable emergency room and hospitalization for one patient in our community is $55,000.
Wow, that's crazy.
$5,000 for the family.
Yep.
$55,000 that, by the way, you and I pay, because those costs get passed to the hospital. They get passed to the insurance companies. They get passed to employers as the rates go up.
Yep.
So it's, we're trying to turn this endless cycle into a virtuous cycle.
Yeah.
And so that's what we're looking for, is how do we continue? We know this year we'll see at least 16,000 uninsured patients.
Yep.
But we expect that number is going to rise pretty dramatically.
Thank you for sharing that. And those numbers are horrible. But it stresses the great importance of your work. So thank you. And thank you just for the work that you do day in and day out.
Well,
it's wonderful for our community.
Thank you to the Empty Stocking Fund. You do, and you bring the community in to make miracles happen. And that's how it feels on our end.
Well,
and we're so grateful. We're so grateful to be a really long-term partner. And, when we're in our budget discussions right now, it's that time of year. And it's always such a relief to say, but this is going to be covered by Empty Stocking Fund. And so to our community, thank you so much. And thank you for really touching people's lives and helping them stay at work, helping them stay in school, helping them take care of our families. Because this isn't some group of other. We're talking about your neighbors, your family. We're talking about your employees. This is your colleagues. These things hit everybody. How many paychecks are you away from a crisis? I know how many paychecks I'm away from a crisis, and it's sobering. And so I hope that should I ever need it, Peak Vista will be there for me too.
If you want to help great organizations like Peak Vista and the Empty Stocking Fund, please go to emptystockingfundco.org and make your donation this holiday season. Every dollar stays local and helps make stories like this possible. Thanks again, Lisa.
Thank you, Danielle. And Emma Grace says thank you also.